trying to flip this gear from the social determinants of health and to survivorship, they are really directly related. We believed that these were two areas where physicians often say, or their perceptions is, that they're well aware of these factors, that the knowledge of them and the incorporation of them is part and parcel to patient care. But we weren't so sure. We wanted to be able to go out to our network, so that's our open network, oncology provider extended network, 7,000 strong, with whom we do market research and real-world evidence research, and we wanted to get a number of them, somewhere in the 100, 200 range, in order to really see to what extent do they understand social determinants, to what extent do they really talk about survivorship, and how is it impacting their practices and their patient care. And what we find is the perception is that the awareness is very high, but you start to see some breakdown into what is really done with the information, how it's incorporated into decision-making, and what has changed as a result of it. So if I expand on that a little bit, because I look at the numbers, we're talking about survivability over a 5 to 7 year period will likely double the number of survivors from cancer in this country, somewhere in the range of 10 to 12 million to 20 to 24 million in less than a decade. And the question is, so what does that mean? And at one point in time, if you go back a decade, it meant a great deal because all those individuals would likely not be able to become insured. And so, the ACA addressed that with the pre-existing condition clause so that insurance is no longer predicated on, whether you had or did not have a potential high-cost pre-existing condition. But that was the limited awareness of it and thought about it. But the question is, what are those factors? From the psychological, the PTSD that just recently was reported is significant in patients in their first year of survivorship, and how does that impact their lives going forward and their interpersonal relationships? And then you get beyond that in terms of chronic disease states and things like chemo brain, terms that we've used but poorly defined and poorly studied. So survivorship is a much bigger issue now than it was a decade ago, because the numbers speak to it, but also because as we look at the OCM, the oncology care model, shared decision-making and patient-centered care, we start to weave in these different aspects coming from different directions, which speak a lot to the quality of life after cancer, where the focus has historically been, how long can I live? And now we're thinking a lot more with a much greater number of cases of curability. We're talking over a 1% decline per year in cancer mortality for almost a quarter century now. So that translates into a lot more cancer survivors. And the interest of them and the fact that both on a national and public policy level as well as on a commercial insurance level, understanding that the impact on those individuals and what do oncologists need to be doing, how well they understand it, and what they need to be doing about it.